A title: What is health information technology and meaningful use?
Thank you for joining our session. What is health information technology and meaningful use? This is the first learning module in a three-part series to provide information and guidance around health information technology, or health IT. The other session titles in the series are Key Roles in Implementing a Certified Complete Electronic Health Record, or EHR, and Key Roles in Maintaining and Optimizing Your Certified Complete EHR. Working in a community health center or other safety net setting, you will encounter various technologies being used to improve patients' health. We want to introduce you to health IT and help you understand its role in your organization.
A heading: Target audience.
This module has been developed as an orientation to health IT for staff working in safety net healthcare settings, such as community health centers, federally qualified health centers, and freestanding clinics. These modules are designed for use in a variety of settings. In an organization that is already live on an EHR, these modules can enhance the new employee orientation process. Alternately, this session could serve as an orientation module for a team that is embarking on their EHR implementation. Finally, health centers focusing on the CMS Meaningful Use Incentive Program would also benefit from this module.
Pre-module questions.
Before we begin, please take a few moments to pause this session and discuss these two questions with your team. This will help facilitate discussion about the topics that are about to be presented. First, in your own words, define health information technology. Then, list 3 technologies you use today.
A message: Please pause module now.
These questions were created to test your knowledge of these concepts before they're presented. The screen will flash first with the questions and will give you a couple of moments to jot your answers down. You will be able to check if your answers are correct. Thank you for taking the time to answer these pre-module questions. Question 1. Meaningful Use is a statewide initiative that is aimed at better connecting health insurance companies to beneficiaries. True or false? Question 2. The High-Tech, or Health Information Technology for Economic and Clinical Health Act, allocates billions of dollars toward the development of healthcare IT and is a part of ARA, the American Recovery and Reinvestment Act. True or false?
Question 3.
The goals of meaningful use are to improve quality, safety, efficiency, and reduction of health disparities, to engage patients and families, to improve care coordination, or D, all of the above. Question 4. What does CMS stand for? Question 5. Which programs are under the CMS EHR Incentive Program? Select all that apply: Medicare, Medicaid, Blue Cross Blue Shield, and United Healthcare. Question 6. There are certain core, menu set, and clinical quality measures that need to be met in order to receive incentive payments. True or false? Question 7. Geomapping is a process used by physicians and researchers that uses software to help better understand our environment and protect us as a community. True or false? And the final question, question 8. Telemedicine is the practice of using technologies to search for healthy supplements in space. True or false? Let's take a look at your pre-module answers. Question 1. Meaningful Use is a statewide initiative that is aimed at better connecting health insurance companies to beneficiaries. This is false. It is a national initiative that is aimed at promoting responsible use of a certified complete EHR to ultimately improve healthcare and reduction of costs. Question 2. The High-Tech, or Health Information Technology for Economic and Clinical Health Act, allocates billions of dollars toward the development of healthcare IT and is a part of ARA, which is the American Recovery and Reinvestment Act. This is true. Question 3. The goals of meaningful use are to improve quality, safety, efficiency, and reduction of health disparities, to engage patients and families, to improve care coordination, and D, all of the above. The answer is D. Question 4. What does CMS stand for? It is the Centers for Medicare and Medicaid Services. Question 5. Which programs are under the CMS EHR Incentive Program? The answer is A and B, Medicare and Medicaid. Question 6. There are certain core, menu set, and clinical quality measures that need to be met in order to receive payments. Is this true or false? And it's true. Question 7. Geomapping is a process used by physicians and researchers that uses software to help better understand our environment and protect us as a community. And that is true. The answer is A. Question 8. Telemedicine is the practice of using technologies to search for healthy supplements in space. This answer is false. Telemedicine is the use of telecommunication and information technologies in order to provide clinical health care at a distance.
Objectives.
We will look at health information technology, or health IT, from 3 different perspectives at a health center: the patient, the provider, and a health center administrator. Each employee will share how her job function relates to our learning objectives in this session. They will help us define health IT, identify ways in which it is used by patients and healthcare practitioners, and understand the Meaningful Use Initiative and its impact on health IT. In today's world, technology can be used to communicate, to inform, and to educate. It helps us with all of the following: keeping in touch with our family and friends, getting updates on the latest news, sports, and politics, sharing pictures, and downloading music and videos. Technology connects us to the world. As you will learn, technology is becoming increasingly important and accessible to clinicians and patients. It gives providers legible documentation, securely stores patient information, and provides a mechanism to better coordinate care.
A heading: Health Information Technology.
The term Health Information Technology, or Health IT, is a broad concept that encompasses an array of technologies to store, share, and analyze health information. Health information technology incorporates the use of computer hardware and software to privately and securely store, retrieve, and share patient health and medical information. Health IT can be used by everyone to better communicate with your provider or healthcare team, to learn and share information about your health, and to take actions that will improve your quality of life. More and more healthcare providers are using health IT to improve patient care. Using health IT, everyone has a role on the team that promotes staying healthy.
A heading: Meaningful Use.
The American Recovery and Reinvestment Act, otherwise known as ARA, was signed on February 17, 2009. Title 13 of ARA, called the Health Information Technology for Economic and Clinical Health Act, or HITECH, allocated $19.2 billion toward the development of health IT. This act seeks to bolster health IT to improve the delivery of healthcare in the U.S. by incentivizing the implementation of certified complete electronic health records, and it provides standards to use EHRs in a meaningful way. With various provisions and regulations, the Act provides assistance, tools, and resources for healthcare providers to allow for the implementation and utilization of electronic health records. This was a major initiative in transforming our health delivery system, and it's had a tremendous impact on health centers. The goals of meaningful use are to improve quality, safety, efficiency, and to reduce health disparities, to engage patients and families, to improve care coordination, improved population and public health, and to assure adequate privacy and security protections for personal health information. This is directly in alignment with our goals as community health centers and safety net providers. What is the vision for the stages of meaningful use? The 3 stages of meaningful use include ambitious but achievable goals that enable eligible professionals to make incremental progress in adopting and implementing a certified, complete electronic health record. Stage 1 consists of transferring data to the EHR and being able to share information, including electronic copies and visit summaries for patients. We want to focus on ensuring that we are capturing the data electronically. Stage 2 includes standards such as online access for patients to their health information and electronic health information exchange, or HIE, between providers. Are we providing quality care as efficiently and effectively as possible? And Stage 3 focuses on demonstrating that the quality of healthcare has been improved. Are patients actually getting better?
CMS EHR Incentive Program.
Depending on the organization, eligible professionals, eligible hospitals, and critical access hospitals qualify for incentives from Medicare or Medicaid. There are differences in the requirements and the level of incentive dollars that can be earned between the 2 programs. The Meaningful Use Initiative incentivizes certain healthcare workers as eligible professionals. Some examples of eligible professionals include physicians, advanced nurse practitioners, dentists, and physician assistants who deliver services in a federally qualified health center or rural health clinic that is led by a physician assistant. You can learn more about the EHR incentive programs from the Centers for Medicare and Medicaid Services, or CMS.
Quality measures.
The Meaningful Use Initiative calls for eligible professionals to meet certain core, menu set, and clinical quality measures in order to receive incentive payments. Examples of core measures include recording vital signs and generating clinical visit summaries. Examples of menu set measures include implementing drug formulary checks and submitting data electronically to immunization registries. Examples of clinical quality measures include appropriate testing for children with pharyngitis and prenatal care, screening for HIV. Health center staff, including the front desk, medical assistants, nurses, and providers must work together to achieve these goals. Your organization will assist you in getting the training you need to understand and perform on these measures.
Photos of 3 women.
Let's meet a group of individuals who've been impacted by Health IT and by the Meaningful Use program. Meet Roberta, Dr. Johnson, and Star from Southeast Community Health Center. Each of them are consumers of health information technology in some capacity. Today, they will talk about Health IT from their own unique perspective. Please meet Roberta, a patient at Southeast Community Health Center. Our physician is Dr. Johnson, and our administrator is Star. She's the Electronic Health Record Manager.
The patient. Meet Roberta.
Hi everyone, I'm Roberta. I started hearing about Health IT a few weeks ago from my provider's office. There was a big countdown calendar in the waiting room, along with flyers describing what was coming up. Staff wore pens that said, "Ask me," so I could talk with anyone about how my paper chart would be converted into an electronic chart. The biggest change that I noticed was that computers were set up in every exam room, and the nurses and providers were using it during my visit. I actually sat next to the doctor and watched him pull up all my information into the computer. I was able to see what kinds of labs and tests I would need in the future. Pretty cool. When I saw my daughter's pediatrician at the health center, he pulled up her growth chart right on the screen. At the end of the visit, he asked me to get the visit summary from the MA, and it actually included all of her growth percentiles and listed out the parenting and child development topics we had discussed during our visit. I can't believe all of this was with one click of a button. The health center staff and I discussed additional electronic tools that are available to help me manage my family's health. Through the health center's patient portal, which is a new technology they are using, I can sign in to a secure site and request an appointment, update my health history, or send a question to my provider. I can even see my daughter's immunizations and whether or not she's due for one. I also have an app that reminds me when I need to take my daily medications. I'm testing this out and it seems to work pretty well. I'm hearing that patients living far away are receiving advice and treatment from my doctors. The nurse informed me that this was called telemedicine. I think it's great that other people in underserved areas can reach good care virtually. It's exciting to see how much healthcare is changing.
The provider. Meet Dr. Johnson.
Hi there, my name is Sarah Johnson, and I have been a physician at Southeast Community since I started here during my residency. Our health centers implemented a certified electronic health record approximately 18 months ago. A certified complete EHR is an electronic version of the patient's medical history that is maintained by the provider over time and may include all of the key administrative clinical data relevant to that person's care under a particular provider, including demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. As a clinician and the EHR clinical champion, my primary focus was on the design and implementation of our new system, thinking through how it would impact patients and the quality of care we deliver. It took a core team of dedicated individuals to review all of our current processes, otherwise known as workflows, and go through a redesign process. We discussed how our work would be documented in an electronic chart and how we could use the new EHR to communicate better as a team. It wasn't an easy transition, but our team has continued to meet regularly and optimize our use of the system. I am so glad to have immediate access to the patient's records. No more hunting around for that paper chart. I can also view important information on a single graph or flow sheet. This provides me, at a glance, an overall picture of the patient's health. I can show graphs of important information to my patients, like their body mass index. Over time, it helps us make decisions about what to do to stay healthy. The EHR allows me to quickly create and run reports on specific patient populations. I am able to see how many of my patients are due for a mammogram or physical exam. I can contact them and make sure they make an appointment. I also make sure that I provide my patients with clinical visit summary. These summaries are an overview of what we talked about during the visit. Not only am I meeting one of the core measures for meaningful use by giving it to them, but my patients benefit from having a written copy of their care plan and what they are due for in the future. There are so many benefits of an EHR. For example, with fully functional EHRs, all members of the team have ready access to the latest information, allowing for more coordinated patient-centered care. The information gathered in the primary care setting can be more quickly transmitted to an emergency department, potentially alerting to a patient's life-threatening allergy, so the treatment can be administered appropriately, even if the patient is unconscious. A patient can log on to his record and see the trend of the lab results over the last year, which can help motivate him to make his medications and keep up with the lifestyle changes that have improved the numbers. The lab results run last week are already in the record to tell the specialist what she needs to know, minimizing a need to order duplicate tests. The clinician's notes from the patient's hospital stay can help inform the discharge instructions and follow-up care and enable the patients to move from one care setting to another more smoothly. I know that the Meaningful Use Incentive Program is important for documenting and giving patients access to information electronically. Certified completed EHRs help us not only to improve patient outcomes, but we use EHRs as a tool for enhancing our ongoing quality improvement efforts. The objectives of our quality improvement committees have evolved over time since adopting the certified EHR. The quality improvement team is comprised of key team members from all clinical departments, for their work directly impacts the measures we are monitoring. Through the EHR, we are able to pull real-time data routinely to track important core measures and see how individual clinicians perform over time, in addition to tracking our overall patient health outcomes. We document our efforts made to improve those numbers so we are able to see what interventions are successful and which are not successful. The EHR helps tell us how well we're doing. As a provider, I want to ensure that my team has documented the proper demographics, that we have reviewed problems, that medications and allergies are updated at each visit, and that we talk to patients about the importance of quitting smoking. We not only review our items because it is required, we do it because it is necessary to improve our patients' health. Our health center is very focused on the Meaningful Use Initiative. I'm an eligible professional, meaning that my health center can receive additional funds to support health IT if I meet certain measures of the program. The goal of the program is to help me and other users of the EHR record accurate health information and adopt systems that will ultimately improve health outcomes. In our center, the Meaningful Use program has just been rolled into our ongoing quality improvement initiatives. To bolster my health center's success in the Meaningful Use program, I have to understand the intent of the program and the measures. I have to know where to document those measures exactly in the chart, and I have to monitor how I'm doing my running real-time reports to see if I'm meeting those measures. It's been an incredible journey watching my health center go live on our certified electronic health record. Now we're constantly trying to find new ways to improve its use for our benefit.
The EHR Manager.
Hi, my name is Star, and I led the EHR implementation team at my health center. I worked with key staff on this project for several months. During this time, we discussed the role of the EHR in our clinic, what functionality is available, how it supports us, and most importantly, how it helps our patients. We reviewed and redesigned health center processes, or workflows, to make them more efficient. It was important that the health record was accessible to our patients, so the patient portal was a perfect solution. Now that that system is in place, the real work and fun begins. Maintenance of the certified EHR is quite like a car. For a car to run smoothly, there are certain things that have to happen. Check the engine, test the brakes, make sure the oil is changed, fill up the gas tank, and of course, you have to drive the car. For our EHR to continue to be a useful tool, our team still comes together to discuss what's working and what needs to be improved. Topics often include reviewing the budget to see what other technologies would benefit us, training both new and current users, changing workflows to make them more efficient, reviewing the clinical templates that our providers use, and talking about use of new features, called secondary functionalities, like electronic prescribing. If I am doing my job well, our clinicians will become meaningful users of the electronic health record. As the EHR Manager, I have an important role in my health center's Meaningful Use initiative. I completed attestation that our health center has adopted, implemented, or upgraded to a certified complete EHR. I know and understand the intent behind the Meaningful Use measures. I help to train providers on where to document so they can meet the measures. I create and run reports specific to Meaningful Use. The reports I run can be done in real time. A certified EHR allows for real-time data analysis to identify opportunities for interventions and proactive outreach attempts for individuals who haven't come in for important preventive care, such as mammogram or pap smear. And finally, I submit the Meaningful Use data to the government, meeting all deadlines, of course.
As we heard from our patient, provider, and EHR manager, there are so many health information technologies currently used today. Certified complete EHRs promote comprehensive and legible documentation of patient health. Telemedicine allows patients and providers to communicate with experts in distant locations. Patient portals are used by patients to type in their own health information, retrieve their health records, and communicate with their care teams. E-prescribing comes in handy for the providers and patients alike. Providers can send and receive prescription requests to pharmacies, which creates efficiencies through avoiding lost prescriptions, reducing errors due to handwriting, and minimizing the number of faxed prescription renewal requests showing up in the provider mailbox. Patients benefit as well with this technology once they establish a preferred pharmacy. Other technologies are available to help improve patient care. Personal health tools help patients track their fitness or medication schedule. There are apps available for your smartphones for that. Health-related informational websites can be used to learn about and improve health. You do want to make sure that it's a trusted website. Healthfinder.gov is an example of one of those good, secure sites. Email and text messages can remind patients about appointments or help manage certain chronic conditions. And online communities can help people connect with one another to try to maximize good health, such as during pregnancy, or to respond to concerns about poor health. Through online communities, you can share information with and emotionally support others facing similar concerns about a particular disease or disability. Finally, there are other types of health information technology being used today to protect us as a community and to understand our environment. One such process, called geomapping, requires use of a software tool to look at the correlation between food access in an area and how that will affect diet-related diseases like obesity or diabetes. Or, public health professionals use it when reviewing environmental disasters or an incidence of a disease like cancer nearby. It is always good to remember how our paper medical records looked. We have gone from this
Files.
to this.
A computer screen.
Certified Complete EHRs exist in attempt to organize our health documentation and make it readable and reliable for all caregivers. With a Certified Complete EHR, we can pull useful data out of the record to share it with the care team, clinicians, and other health center staff. It makes a big difference when we share this type of patient-level and population-level data with all members of the team. They see the impact their work has on how patients are improving. Let's face it, health information technology is awesome. So, where can you go to get started?
3 web addresses: hrsa.gov, healthit.gov, and cms.gov.
Thank you for joining us. Please make sure to check out our other education modules on implementation and maintenance of a certified complete electronic health record.
Brought to you by the U.S. Department of Health and Human Services, Health Resources and Services Administration.